All right. Thank you all so much for joining us today. We are going to go ahead and get started in just a minute. All right. My name is Kristen Mackey. I'm the Walk Cares Fund Community Relations and Outreach Program Manager. I'm really glad to have you all joining me today. We will have time at the end of today's presentation to answer any questions you have. Anyone who's joined us on a computer or using the Zoom app on their phones will be able to submit questions through the Q&A function at any point in the presentation. If you joined by calling the phone number only but want to ask a question, you can find the link to join by computer or the app on our website at wcaresfund.wa.gov/webinars. Here's a quick overview of topics that we're going to be covering today. We'll start with an overview of what long-term care is and how it impacts people who need care, their families, and the workplace. And then we will talk about how Walk Cares works. Let's start by defining what we're talking about when we say long-term care or caregiving. Long-term care is help with activities of daily living like bathing, eating, dressing, preparing meals, grocery shopping, and more. It does not include medical care like doctor's visits and treatment for medical conditions. Long-term care covers a broad spectrum of needs and circumstances, including for younger people who have been unexpectedly injured or become disabled or ill. A lot of people don't realize what a broad range of services can be included when we talk about long-term care. We often think of it as care in a residential setting, like a nursing home or assisted living, but it can also include care provided in your own home. And in fact, most people with long-term care needs can stay in their own homes with the right support. It's also very common for family caregivers to not realize they are a caregiver. You might go to your mom's house a couple times a week to cook meals, drive her to appointments, and make sure she's taken her meds, which are all common care activities. In fact, the majority of this type of care is provided on an informal basis, unpaid care from a family member, a friend, or a neighbor. And I'm going to go ahead and start a poll about everyone who's joined, your experience with long-term care and caregiving. If you joined by computer or the Zoom app, would really appreciate it if you could go ahead and put in your answers just to make sure that I know who we've got in the audience today. And we'll see in just a minute what the responses to the poll tell us about this group's experience with caregiving. But generally speaking, we all have care stories in our families and communities. Family caregiving is really the bedrock of long-term care. There are 860,000 family caregivers in Washington, which is about 11% of the population. And I wanted to share a couple stories from Washingtonians who are getting the kind of help that Walk Cares is really designed to provide. So this is KD, who lives with her husband, children, and her mother-in-law, Kathleen. Kathleen has MS and needs in-home care to help with daily tasks like bathing, dressing, and eating. Getting some help each day with these activities means that Kathleen can stay at home with family and enjoy time with her grandkids. And while KD is grateful to have Kathleen living and receiving care in their home, she does find that the expenses and demands of managing care take a toll. And she says that a program like Walk Cares would have made a difference for their family. And this is Sally and Patty. Patty has Parkinson's disease and gets a few hours of help each day with activities like eating, bathing, and getting around the house. Getting in-home care not only helps Patty, it also means that Sally can get a break to do things like grocery shopping or going for a walk with friends. And Sally says that a program like Walk Cares would have helped her take care of unexpected long-term care expenses. And because of her background working with caregivers, knows that it would be a big help to other families in similar situations. All right, I'm going to go ahead and end the poll. Thanks to everyone who was able to answer those questions. It looks like we've got a lot of folks who have provided unpaid care to a family member or loved one in the past, or who are doing so currently. That's just about 40% of the folks who are here. And then we do have also a pretty big contingent of folks who don't have direct experience with long-term care and aren't very familiar. So hopefully This is helpful for all of you. So we are going to keep moving through here. Long-term care is a predictable expense. In fact, 70% of us will need long-term care at some point in our lives. And the problem is that long-term care can be really expensive. It costs about $33,000 a year for 20 hours of home care per week, which is the average needed by current Medicaid long-term care clients. It's also important to note that family caregiving isn't free either, and we'll talk about that a little more in a second. Because long-term care is not medical care, it's not covered by health insurance or Medicare, except in very rare circumstances. And it's only covered by Medicaid after you have spent down your life savings to just $2,000. Even though it is a predictable cost, most of us don't have a way to pay for it. The median household income for Washington seniors is $56,000 a year, and half have no 401k or pension income. So for most of us, if we live long enough, it's not a question of if we'll need Medicaid someday, but when we'll need it. This is especially critical because our population is aging rapidly. The number of people who are 85 and older, which is the blue line on this graph, will more than double between 2020 and 2034. And the caregiver support ratio, which is the number of potential family caregivers ages 45 to 64 for everyone 80 and older, is declining sharply. So that's a lot of words, but essentially it means that a lot less family support will be available for people in the high-risk years for needing care, and that family caregivers will be more likely to be providing care for multiple loved ones at a time. That means that as a society, we will need to figure out how to provide better support for caregivers and how to be more innovative in paying for and delivering long-term care services. While walk cares may seem like a new expense for workers, it is important to keep in mind that our current system, where we rely on unpaid family caregivers to provide the vast majority of care, isn't actually free. Almost half of family caregivers experience a related financial setback, and on average, they spend about 25% of their own income on care-related expenses. It's really common for caregivers to leave the workforce early in order to provide care. And for caregivers 55 and older who do this, they lose an average of more than $300,000 in wages and benefits. And most working caregivers say that a program that paid them for the hours they provide care would be helpful. So walk cares is not an additional expense for families who need long-term care. It's just a more efficient, family-friendly way to do so. Long-term care also impacts the workplace. Washington State, like the rest of the country, is experiencing a labor force shortage. And with this kind of shortage, it's critical to keep as many people as possible in the workforce, and care responsibilities can have a big impact. The majority of caregivers work full-time on top of their care and family responsibilities, and most report that it impacted their job in some way. Over half say that they have to go in late, leave early, or take time off to provide care. 15% report reducing their hours. Many, about 8%, report receiving warnings about their performance or attendance, turning down a promotion, quitting, retiring, or losing benefits. And while many caregivers find their role rewarding, it can also be highly stressful. Nearly 1 in 4 report that their health has worsened since they took on the role. Long-term care is a significant driver of state budgets, and it has accounted for about 6.3% of the state budget over the past 2 years. We really don't think about it often, but these costs are paid for by all Washingtonians through taxes on goods and services. As our population ages, costs will rise accordingly. So without walk cares, sales and other taxes would have had to go up to meet the costs of the age wave, and more family caregivers would have had to quit their jobs and sacrifice their financial and retirement security in order to provide care for a loved one. Walk Cares is a universal long-term care program in Washington State. It's an earned benefit. You contribute for a certain number of years in order to qualify for benefits, and it is self-funded from worker contributions, which go into a dedicated trust fund used only for this program. Workers contribute 0.58% of every paycheck to WACARES, and you can see here what this looks like for the typical worker who makes just over $50,000 a year and would contribute about $24 per month or $12 a paycheck. You only contribute to WACARES while you're working. Contributions stop when you retire or if you become unemployed. With WACARES, everyone is covered at the same rate, regardless of pre-existing conditions. And when it comes time to claim your benefits, there are no copays, no deductibles, and you never need to file a claim. We connect you with contracted providers for the services you want and pay them directly. Contributions to the program will begin in July 2023, and benefits will become available in July 2026. This is what contributions look like over the course of a career. The typical Washington income is just about at the level of green there in the middle. And you can see that $290 in contributions each year totals out at $8,700 over 30 years. And once you've met contribution requirements, you'll have access to that $36,500 benefit amount, which is adjusted annually up to inflation. Almost all Washington workers contribute to WACARES. Here is a breakdown of some of the exceptions. Some workers are automatically not included in the program, and that's federal employees. Employees of tribes are only included if the tribe opts in. Self-employed people are also only included if they opt in. And other workers can get an exemption, which they must apply to the Employment Security Department to get. There are two types of exemptions that are permanent. Veterans with a service-connected disability rating of 70% or greater, who have access to some nursing home care through the VA, can choose to apply for a permanent exemption. These applications became available January 1st of this year and are available on an ongoing basis. There was also an exemption available for workers who had private long-term care insurance before November 1st, 2021, which was really intended to grandfather in those who already had a private insurance policy as the program began. These applications are no longer available, but under current law, workers who already have an approved private insurance exemption will continue to be exempt permanently. Some workers can apply for an optional exemption based on meeting certain conditions. This includes workers who live out of state, workers with non-immigrant visas, and spouses or registered domestic partners of active duty military. These three exemptions were created for groups of workers who would be unlikely to qualify for or use their benefits. They are available on an ongoing basis and are conditional. So that means the person must continue to meet the exemption criteria in order to maintain their exemption. If they no longer qualify, they have to notify their employer and ESD within 90 days. Everyone who contributes to the WACARES Fund more than 500 hours per year is earning benefits, part-time and temporary workers included. By contributing for a certain number of years, you qualify for the $36,500 benefit. There are three pathways to meeting that contribution requirement. The first is early access for workers who haven't yet been able to earn lifetime access, but have a care need either while they're working or soon after they leave work. So this is for anyone who has contributed at least 3 of the last 6 years at the time they apply for benefits. There is also the lifetime access pathway, which is for workers who contribute for 10 years without a break of 5 or more consecutive years. And finally, there's a special pathway for near retirees. This is new as of last year. So for anyone born before 1968 and is therefore near retirement as the program begins and unlikely to qualify for the 10 years pathway, can earn 10% of the benefit amount for each year that they work. For example, if you work and contribute for 500 hours or more per year for 3 years, you'd earn 30% of the benefit amount or just under $11,000. Another example, you could work 500 hours after contributions start in July and retire at the end of 2023. And you would, again, still earn 10% of the benefit amount. And near retirees will have permanent access to whatever percentage of the benefit amount they earn at any time that they need care. They're also able to qualify through one of the other pathways if they meet those requirements. And once you meet contribution requirements and need help with at least 3 activities of daily living, you can get access to a $36,500 budget for services and supports. And again, that benefit does increase over time with inflation. With WalkCares, you get the flexibility and freedom to choose the services that meet your needs. So that could mean in-home or residential care, but it could also include home modifications to make your home safer, and assistive technology for things like medication reminders and fall detection that can help with some care needs. WalkCares is designed to help people age in place in their homes as long as possible, which is what almost all of us want to do. And it is also structured to support family caregivers. You can choose someone who would otherwise be caring for you on an unpaid basis to get training and be paid, and that includes even your spouse. So WalkCares can really help lessen the impact on family caregivers by paying them for their time or making sure that they can get other support services. We get asked a lot about how far this benefit will go, and the truth is it won't cover 100% of care for everyone. It would cover 20 hours per week of home care for about a year, and again, that's the amount of in-home care that the average Medicaid client receives right now. About a third of people need care for a year or less, and for those people, WalkCares may be able to cover all the care that they need. And for others, WalkCares provides the family with immediate relief and breathing room to plan for future care costs. Let's talk briefly about the role of employers. Employers don't contribute to WalkCares, only workers do. All employers need to do is collect premiums for all of their Washington workers, except those who have provided confirmation from ESD that they are exempt. And if you're wondering if someone counts as a Washington worker, the definition is the same as paid leave. So any employee that is part of paid leave premiums will also contribute to WalkCares. Premium collection begins July 1st, 2023, and employers will remit employee premiums and report wages to ESD starting in October 2023. Employers do not need to process exemption applications. ESD is the entity that does that, and they began accepting exemption applications for those ongoing exemption types as of January 1st of this year. And any worker who has previously received an exemption approval letter from ESD does still have a valid exemption and does not need to reapply. So if you're an employer, make sure to keep those exemption letters on file. If you're an employee with an exemption letter, make sure that your employer has it. If you can't find your exemption letter, you can download a copy from the Secure Access Washington account that you use to submit your application. WalkCares is a cross-agency program, and multiple state agencies have responsibilities in designing, developing, and implementing the program. Right now, as contributions begin, you might need to reach out to the Employment Security Department for help with an exemption application or opt-in application, or as an employer for premium reporting. In the future, you'll likely interact with DSHS as you apply for benefits and get a care needs assessment. HCA also has a responsibility for paying providers, and the Office of the State Actuary is responsible for ongoing actuarial analysis to make sure that the fund remains solvent. And that is what we've got for the main presentation today. So we are going to go ahead and answer some questions. Let's see what we've got. We have someone asking if employees let their long-term care policy lapse but received an exemption, are they still allowed the exemption? And will there be some type of verification process for those with an exemption due to having their own long-term care policy to prove they still have a policy in place? And the answer to that is that under current law, there is not a ongoing verification process. However, the legislature did ask the LTSS Trust Commission, which is the oversight body for the WA Cares program, to look into options for requiring some kind of ongoing recertification from workers with an exemption. And the LTSS Trust Commission did make a recommendation on that to the legislature as part of their 2023 recommendations report, which you can find on our website for more details. So under current law, no, but it's a possibility in the future. And then let's see, the original implementation timeline was postponed, though it was announced back in 2019. The WA Care system didn't allow me to file for an exemption at that time. I tried on 2 different occasions where it didn't allow me to enter. Where can a person access this schedule? So if you have questions about anything related to exemptions, you can find contact information for the Employment Security Department on our website at wacaresfund.wa.gov. And I think that they should be able to answer any specific questions that you have about your exemption applications. We've also got someone asking if Oregon residents working in Washington purchased a long-term care policy and received a private insurance exemption and want to cancel that now, do they need to reapply for the exemption based on out-of-state residency? My understanding is that they would need to apply for the optional exemption if they want to receive an exemption on that basis. However, it is important to keep in mind that those exemptions are conditional based on whether they continue to be living out of state and have their permanent address out of state. And let's see. We've got a question about what qualifications will be needed to receive WA Cares benefits. So that we covered a little bit earlier. There are 2 aspects to getting WA Cares benefits. First of all, you must meet the contribution requirements, which are those 3 pathways that we talked about. And then you must have a care need. So that's the part about needing help with at least 3 activities of daily living. And essentially, what will happen as part of that assessment is DSHS will ask you about your activities, where you need help, and then if you are able to meet both of those requirements, you'll be able to access your benefits right away with no waiting period. We've also got someone asking, is $36,500 an annual benefit or a total lifetime benefit? It is a total lifetime benefit. So that's once you reach the end of that $36,500 budget, your WA Cares benefits are used up. Let's see, we've got someone asking, will this presentation be available on the WA Cares site? Yes, this presentation and all of the materials from our webinars, including a recording of this webinar, are available on our site at wacaresfund.wa.gov/webinars. We've got someone saying, I'm retired but work part-time. And how does someone like me who will have to pay for WA Cares benefit from this? As long as you're working 500 hours or more per year, you actually are earning WA Cares benefits, and that's about 10 hours per week. So there are a lot of folks who are working part-time who will still be able to earn benefits. And if you're retired right now, then it's pretty likely that you will be able to use that near retiree pathway, which allows you to get partial benefits for each year that you work. So If you work 500 hours or more per year for a couple more years, you would be able to get 10% of the benefit amount for each year that you worked. We've got someone asking what happens if you change jobs. And if you are paying into the program, then there shouldn't be any impact for you if you change jobs. If you have some kind of an exemption, you should keep track of your exemption letter and make sure that your new employer receives it when you get to your new job. We've got someone asking if employees can still apply for the exemption. So those, it depends on what kind of exemption. If you have private insurance, the window for applying for an exemption has now closed. But if you qualify for one of the other types of ongoing exemptions, which we talked about earlier, so for folks who live out of state but work in Washington, spouses and registered domestic partners of military members, people here on a non-immigrant visa, and veterans with a 70% or higher service-connected disability rating will all still be able to apply for exemptions on an ongoing basis. So if someone, for example, ends up moving out of the state but still works here and would like to apply for that exemption for workers who live out of state, they will be able to do so. Yeah, those ongoing exemptions will continue to be available on a rolling basis. And we've got someone asking, given how expensive long-term care is, how did you arrive at $36,500 as the maximum benefit? So it's really a balance between the amount that we're requiring people to contribute in premiums with the amount that we're able to provide as a benefit. And like I said earlier, we do recognize that it's not going to be enough to cover 100% of care for everyone, but it will cover basic needs. And again, really designed to help folks stay in their homes as long as possible. And for folks who are getting that in-home care, the benefit is going to last a lot longer than for someone who is getting care in a nursing home. So it really depends on how you use your benefit, what you use it for, but folks will have the ability to make that choice for themselves for what they need. Let's see. We've got someone else asking about the contribution requirement and what if I retire in a couple of years, do I have benefits? And again, that is something through the near retiree pathway for folks who were born before 1968. Yes, you will have earned 10% of the benefit amount for each of those 2 years. So you'll get 20% of the total benefit amount, and you'll be able to access that at any point in time. We've got someone else asking about private long-term care policies. If I purchase one now, can I apply for an exemption? And the answer to that is, again, no, the window for private insurance exemptions has closed. So under current law, there's not another opportunity to submit an exemption based on private insurance. All right, just looking for some new questions. If there is a break of 6 years, does that mean to get lifetime access to the full benefit, I would need to work 10 years again consecutively? Under current law, yes. If you have a break of 5 or more consecutive years in your working life, then your count for qualifying years goes back to 0. However, the LTSS Trust Commission did make a recommendation to the legislature in its report and its recommendations for this year to remove that qualification so that it would just be as long as you had worked a total of 10 years, you would still have access to the benefit. So we'll see what the legislature does with that recommendation. And we've got someone asking, what if you plan on retiring early? So if you're a near retiree, but were born after 1968, that's a great question. So you would still obviously contribute to WACARES, and if you need care soon after you retire, and if you meet that 3 of the last 6 years at the time that you apply for benefits requirement pathway, then you would be able to access benefits. But if you need care later on, but have not met any of the contribution pathways, then you won't be able to access WACARES benefits. Let's see. How will an Oregon employee that moves to Washington be treated if they have to contribute to the program? Will they get access to the long-term care benefit through the state? Yes, someone who moves to Washington later on will contribute to the program and will be able to access benefits. And if you are someone who has been working in Washington and living out of state, but then you move into Washington, you have a conditional exemption, you do need to, again, let ESD and your employer know that you no longer meet the requirements for that exemption. And at that point, you begin contributing to WACARES, and you are able to earn and access WACARES benefits. And we've got someone asking, what if you moved away from Washington State before retirement? Is the benefit portable? And the answer to that is that under current law, you do need to live in Washington State in order to access benefits. And that is another piece that the legislature asked the LTSS Trust Commission to study and make recommendations on. So the Trust Commission submitted some recommendations to the legislature on how to make sure that folks are able to access some kind of benefit if they move out of the state after retirement. But really the reason for that is that we are the first state in the nation that has put together a program like this. And so in different states, there are different requirements for what qualifies someone to provide long-term care. And because the state contracts with providers, we have to make sure that they meet certain requirements. So in order to do that, it's difficult to do that in other states. And so we have to kind of look at other ways to make sure that people get a benefit if they move out of state. Let's see, we've got someone asking, this is mandatory for all Washington State employees with the average of $435 each year for an employee of 55,000 or more. So I think there's a little bit of a misunderstanding there about what the contribution looks like. So it is 0.58% of your paychecks. So for someone who is making the typical income, which is about $50,000 a year, you would be contributing about $291 per year. So it's a little bit different price than you're thinking of there. Let's see. We've got someone asking, is there any inflation protection growth on this? Yes, the benefit will be adjusted annually up to inflation, and that includes after you retire and stop working and are no longer contributing. Your benefit amount will still go up with inflation. And we've got someone asking, do out-of-state residents and employees have to pay into this? For those folks, they can get an exemption, but they do need to apply to ESD in order to get that exemption. And there's more information available on that on our website if you'd like more info. Let's see. We've got someone asking if this impacts people who are on SSDI, but work part-time. And the answer is it for anyone who works part-time, as long as you're working at least 500 hours per year, you are earning Walk Care's benefits. Let's see. How do self-employed people sign up to contribute? So that's a great question. We do have some information for self-employed people available on our website, but the application will become available July 1 of this year. And essentially, they will submit an application to opt in, and then we'll report on their earnings and make contributions to the program, and will earn benefits like anyone else who is contributing to the program. Let's see. Can you receive benefits if you're still currently employed and caring for a loved one? So just for clarity, the person whose benefits you would be using are for the person who needs care. So if your loved one has a Walk Care's benefit and you are caring for them, they will be able to use their benefit either, to pay you to provide care, or perhaps to get respite care so that you can take a break, or in-home care of some kind to help support you. But the benefits that are received are for the person who needs care rather than the person who is giving care. Let's see. Got a lot of repetitive questions in here, so I'm just scrolling through to find something new. So we've got some folks asking about pathways to obtain partial benefits for staff who are retiring soon. So I'm just going to track us back through the presentation a little bit so that people can take another look at the pathways slide. So these are the 3 different pathways for qualifying for benefits. And someone who is a near retiree is able to get that lifetime access to 10% of the benefit amount for each year worked. So this column here on the right. And we've got someone asking about employers contributing to Walk Cares, and will employers be able to access funds if they need long-term care? And so if you're thinking of it in terms of maybe the head of a company, if they are a W-2 worker, they are going to be contributing to Walk Cares and will be able to access benefits. If you are talking about someone who is self-employed, then they will be able to opt in and access benefits if they choose to. And we've got someone asking if we have employees working out of state and we don't deduct for paid family and medical leave, do these out-of-state employees have to apply for an exemption in order for us to not deduct for Walk Cares? No, they do not need to apply for an exemption if they already are not employees that are part of paid leave. It's the same definition for whether their work is localized in Washington state as paid leave. So those employees do not need to apply for an exemption. It's only employees whose work is localized in Washington who are also contributing to paid leave. Let's see. We've got, is the rate for the premium the same for all employees, or is there a different rate for people born before 1968? Everyone pays with Walk Cares the same low premium rate. It's 0.58% of your earnings for all employees. And, unlike private long-term care insurance, you don't get a different rate if you have pre-existing conditions. Women don't pay more than men, like is often the case in private long-term care insurance, everyone pays that same rate. We've got someone asking, can employees contribute more than the 0.58% per paycheck? And the answer is no, not to Walk Cares itself. So instead of thinking about it like a savings account where you contribute a certain amount of money and access it, Walk Cares is really a social insurance program like Social Security. So it's set up so that everyone contributes a little bit over time, and then that money is available for anyone who happens to need care. But if you are interested in additional coverage, something we're working on right now is a supplemental private insurance market. And so under that, assuming that it is adopted by the legislature, folks would be able to purchase supplemental policies, very similar to Medicare, and then would be able to get additional coverage, and the Walk Cares benefit would function as essentially their deductible for their private insurance plan. That is still in progress, so you can stay tuned for more information on that. We'll keep adding information to the website and send updates to our mailing lists when there's new developments like that to the program. And we've got someone asking for part-time employees, let's say 20 hours per week, is their benefit amount reduced? No, anyone who is earning Walk Cares benefits is getting qualifying years towards meeting this contribution requirement that's still up on your screen here. And everyone who meets contribution requirements and needs care is able to access, for the first two pathways over here, the full benefit amount. The only group that is accessing maybe a partial benefit amount is if you're a near retiree and you didn't qualify for lifetime access to the full benefit, but you did work maybe a couple years, then you get access to that partial benefit amount. Let's see. So we've got some folks asking about whether the benefits are non-taxable. So essentially, we contract with providers and you will be able to look up a provider that provides the services that you're looking for. And then we will reimburse the provider for those services. So you're not receiving money for the benefits, you're just receiving the services. Let's see. We've also got someone asking for workers who had private insurance and became exempt through the state and then have dropped that coverage, who want to opt back in. Will they be able to do so? There isn't a mechanism to do that under the current law, but that is also part of the LTSS Trust Commission's recommendations to the legislature. There's a recommendation for how we might be able to allow folks who do want to opt back in to do so for a limited period of time. And we've got someone asking if someone works less than 500 hours per year, can they qualify for partial benefits? And the answer to that is no, you do need to be working at least 500 hours per year in order to earn benefits. We've also got someone asking if there is a limitation on the percentage collected. So essentially, will that premium rate go up over time? And our premium rate is set by law, so it is in statute. So in order to increase that premium amount, the legislature would have to take action and change the law. However, we do have some recent actuarial analysis as of last fall that we are going to be solvent at the current premium rate under most plausible scenarios. So essentially, we don't have any concerns about the fund being underfunded for the benefits that people need, and therefore needing to raise the premium rate in the future. Let's see. So we've got someone asking, can you clarify if an employee lives in Oregon but works in Washington, they're exempt from WACARES, but are Oregon residents who work in Washington not supposed to be paying into Washington paid leave? So the exemptions are just for WACARES. The kind of paid leave comparison is to help you understand whether someone is supposed to be paying into WACARES at all. And then out of that group of people who pay into WACARES, some people, including people who live, for example, in Oregon and work in Washington, are able to apply for that exemption. They do need to apply, and that exemption is conditional upon them continuing to live outside the state. And let's see. We've got some folks asking who to contact to voice opinions about the private insurance exemption process and how all of that works. You are welcome to contact your legislator because they're the ones who will be considering any changes that might happen to the law in the future. We've also got someone asking, is there a waiting period before the coverage begins to pay for the care? No, as soon as you are, as soon as you need care and complete your needs assessment with DSHS, you will be able to access benefits right away. So unlike private insurance, where there is often a waiting period of up to 120 days where you have to pay out of pocket for a certain amount of time, WACARES does not have a waiting period or a deductible in that sense. You'll be able to access your benefits right away. Let's see. We've got someone asking whether this is optional and if someone working full-time can opt out, or if this is mandatory pay deduction for people under a certain age. So almost all Washington workers, unless you meet one of these categories, are contributing automatically. It is a mandatory pay deduction for anyone who is not one of these groups. And if you are in one of the optional groups, you do have to apply and get that exemption letter in order to opt out. So we've got someone asking about are other states required to collect and remit this to Washington for Washington residents that work out of state? No, the premiums are for folks who work in Washington. Let's see. We've got someone asking, I have a current long-term care policy and applied for an exemption. Will you show the website to check if it's approved or not? And do I have to submit a copy of my policy? So if you submitted an application for an exemption, you should have received a letter letting you know if you're approved. If you did not, or if you're not sure, you can either go to our website. There's information on logging into your Secure Access Washington account that you use to apply for the exemption to check its status. or you can contact ESD directly. And I'll go ahead, since we're getting close to the end here, show the contact information. So there is both an email contact form that will route your inquiry to the right person on our website, as well as a phone number that you can contact for ESD right there, where you can check on status of your application. And then we've got someone asking, if an out-of-state resident wants to contribute rather than getting an exemption, can they collect if they still live out of state? And so that goes back to the portability question. And so folks who live out of state at the time that they need benefits, at this point under current law, there's not a way for them to be able to access benefits. That may change in the near future. Again, there are recommendations to the legislature for making benefits portable. But at this point, if someone lives out of state and wants to contribute and access benefits, they would need to move into Washington at the point when they need care in order to access benefits. Let's see. Just looking to see if we've got maybe one or two more questions that are new that we can answer before we close out for the day. So we've got someone asking, is the near retiree pathway for each year you worked over your work history, or just each year you worked since contributing to Walk Cares? It is for each year where you are contributing to Walk Cares. So you earn that partial benefit for each year that you contribute for 500 hours or more. And we've got someone asking if we have any flyers and material to share with employees. We do have a lot of materials available right now on our website at walkcaresfund.wa.gov/toolkit. You can also get there by navigating to the employer page and then the employer toolkit. And we are working on some updates to those materials, some additional draft content that you can use to send emails or newsletter updates to your employees. And are hoping to have that available in the near future. So we'll send updates to our Walk Cares mailing list and the ESD employer newsletter when those new materials are available. Let's see. We've got someone asking for employers, what information needs to be reported? Is there a form that needs to be filled out? And so employers will report for Walk Cares the same way that they do for paid leave. So it's the same process. And again, there's more information on that available on our website. Let's see. And we've got someone asking if I work for a Washington employer but live out of the state and am not subject to paid leave premiums, do I need to apply for the conditional out-of-state Walk Cares exemption? No, if you live out of the state and work out of the state and therefore are not paying paid leave premiums, you also you shouldn't need to apply for an exemption. You should just not automatically not have those premiums collected because you are not a Washington worker. And I think we're just about at time here. So I know that there's still a lot of questions that we weren't able to get to. We will email you if your question wasn't answered, as long as you registered for the webinar with your email. But if you are not signed up for the webinar with your email address, and so we don't have your email to contact you, but you still have a question, please do reach out to us. There's information available up here on your screen. for where you can find our email form to contact us directly, as well as phone numbers. We're here to answer your questions. We want to help you. So just let us know what questions you have. And we'll go ahead and close out for the day. Thank you so much to everyone for joining us. We, as I said, will be posting the materials from this webinar and a link to the recording on our website. So you can check back for that. And we will continue to host our monthly webinars as well as these Walk Care's basic webinars. We've got a couple more coming up later this spring if you want to join us again. Thank you so much, and everybody have a great day.